Greetings and welcome to this baseline training on legal and ethical foundations in mental health crisis response. My name is Kim Williams and I am a principal consultant at Health Management Associates, also known as HMA. HMA is a national health and research consulting firm, and we focus on improving the administration and delivery of public health, healthcare, and social service programs. We at HMA are really proud to partner with the Mississippi Department of Mental Health and its efforts to enhance the state's crisis response system. We are providing these monthly baseline trainings, other monthly trainings, and a monthly crisis convening. By way of background, I am a social worker by training, and I have over 20 years of experience in behavioral health, including in behavioral health crisis. And I'm really happy to be with you all to provide you with this training today. So, we are focusing on staying grounded, legal and ethical foundations in mental health crisis response. This course is designed to support all of you working in high pressure environments where quick decisions must be made with both compassion as well as compliance. So, together, we're going to explore legal mandates, ethical principles, cultural considerations, and practical tools to guide your crisis response. These learning objectives are going to help ground our learning and help you build confidence in ethically sound and legally compliant crisis care. So by the end of this training, you'll be able to identify key legal obligations relevant to mental health crisis response, including confidentiality, mandated reporting, and duty to warn, protect. Recognize common ethical dilemmas that arise in crisis situations and apply ethical decision-making frameworks to resolve them, and understand professional boundaries and how to maintain them during high-pressure interactions. So we begin with legal responsibilities in crisis response. In this section, we'll explore the legal foundations that guide ethical and safe practice in mental health emergencies. These responsibilities are critical for both protecting clients as well as you as professionals, especially in high stakes situations. And understanding these responsibilities helps ensure compliance with the law and also promotes responsible care. Beginning with confidentiality. Confidentiality is a cornerstone of mental health practice. It's governed by federal laws like HIPAA, as well as state-specific regulations. While we strive to protect client information, there are exceptions such as medical emergencies, court orders, threats of harm, or abuse reporting. In Mississippi, disclosure is permitted when a client makes an actual threat of physical violence toward an identified victim. This legal nuance is important to remember in crisis situations. How confidentiality applies can differ significantly depending on whether the individual in crisis is an adult or a youth. For adults, confidentiality is generally protected unless there is a clear exception, such as a threat to self or others, or a legal mandate like a court order or mandated reporting. Adults have the legal right to make decisions about their care, and disclosures typically require their consent unless safety is at risk. For youth, the situation is more complex. In many states, including Mississippi, providers are required to report suspected abuse or neglect of minors. Additionally, parents or guardians often have the right to access a youth's mental health information, though this can vary depending on the youth's age, the nature of the treatment, and state laws. In crisis situations, providers have to balance the youth's right to privacy with the legal and ethical obligation to protect them. For example, if a 16-year-old discloses suicidal thoughts but refuses to involve a parent, the provider may need to breach confidentiality to ensure safety and comply with reporting laws. Ultimately, the provider's role is to act in the best interest of the client while staying within the bounds of the law. And this means knowing your state's statutes, consulting with supervisors, and documenting your decisions thoroughly. Now let's discuss the limits and responsibilities around confidentiality. Mississippi Code 412197 establishes that mental health records are confidential and privileged, meaning individuals in crisis have a legal right to privacy. However, this right is not absolute. Disclosure is permitted only under specific conditions, which include written authorization from the client, a court order, continued treatment needs such as coordination with other providers, statutory reporting requirements like mandated reporting of abuse or neglect, and a credible threat of physical violence toward an identified victim. These exceptions are designed to protect both the individual and the public from harm while maintaining the integrity of the therapeutic relationship. Let's also consider the legal protections for individuals in crisis. While confidentiality is a right, it may be overridden when disclosure is necessary to prevent harm or comply with legal mandates. This balance between privacy and safety is a critical aspect of ethical crisis response. On the other side, there are legal protections for crisis responders. If you make a disclosure in good faith under one of the statutory exceptions, you are generally protected from liability. However, this protection hinges on your ability to act within the scope of your professional role, follow agency protocols, and document decisions and rationale thoroughly. A best practice tip, when in doubt, consult with a supervisor before disclosing information and always document the reason for disclosure and the parties notified. This protects your client, your professional integrity, and your organization. So understanding these limits and responsibilities ensures that we provide ethically, legally sound, and safe crisis care. Now let's move on to mandated reporting. Mandated reporting is a legal requirement when there is reasonable suspicion of abuse, whether it's child abuse, elder abuse, or abuse of vulnerable adults. Reports must be made immediately by phone and followed up in writing. In Mississippi, mandated reporting is required of any person having reasonable cause to suspect. Failure to report can result in serious legal consequences. In Mississippi, the law is very clear. A wide range of professionals are legally required to report suspected child or elder abuse, neglect, or exploitation. This includes both licensed and unlicensed professionals, as well as other individuals who may be involved in crisis response. So let's break this down. Licensed professionals are individuals with formal credentials in health and mental health care, including physicians, nurses and psychologists, licensed counselors, social workers, marriage and family therapists, and any licensed healthcare provider. Even if someone isn't licensed, they may still be mandated reporters if they work in certified programs. That includes community support specialists, crisis coordinators, professionally licensed therapists, certified peer support specialists, and case managers and intake workers. Mandated reporting also applies to law enforcement officers, school personnel, including teachers, principals, and counselors, child care providers, clergy, and volunteers working in certified programs. It's important to recognize that not everyone may be aware of their legal obligation to report or may not be trained to recognize signs of abuse or neglect. In these cases, it's essential to clarify responsibilities through agency policy and supervision, ensure that everyone knows who is responsible for making the report, encourage ethical reporting even when the situation is unclear, and document concerns and escalate appropriately within the team. Remember, mandated reporting is not just a legal requirement, it's a critical part of protecting vulnerable individuals in crisis. When in doubt, consult with your supervisor, and again, always document your observations and actions thoroughly. How to make a mandatory child abuse report in Mississippi. When you suspect child abuse, neglect, or exploitation in Mississippi, the law requires you to act quickly and follow a two-step process. An immediate oral report followed by a written report. So step one is to make an oral report and start by calling the Mississippi Child Abuse Hotline. This line is available 24/7 statewide. If the child is in immediate danger, do not wait. Call 911 or your local law enforcement agency right away. Step two is to submit a written report. After making the oral report, you must submit a written report as soon as possible. Use the Mississippi Department of Child Protection Services online portal. And when completing the report, be sure to include the child's name, age and address, name of parents or caregivers, the nature and extent of injuries or concerns, any prior incidents or patterns you're aware of, your contact information, especially if you are a material witness. Remember, your role is to report, not to investigate. Provide the facts as you know them and let the appropriate authorities take it from there. Timely and accurate reporting can be critical to a child's safety. When to involve law enforcement. Under Mississippi law, if the suspected abuse involves serious bodily harm, sexual abuse, or any felony offense, the Department of Child Protection Services must notify law enforcement within 48 hours of receiving the report. In urgent or life-threatening situations, you may also contact law enforcement directly, especially if immediate intervention is needed to protect the child. Photo documentation of injuries or abuse should only be taken if authorized by your agency's policy. If photos are taken, typically by medical professionals, they must be handled in accordance with confidentiality and evidence protocols, ensuring they are properly stored and shared with only authorized personnel. After making a report, it's essential to document the incident in your agency's system. Your documentation should include date and time of the report, method used to make the report, a summary of concerns, and any follow-up actions taken or planned. This ensures accountability and supports ongoing protection efforts for the child. Now let's take a moment to review the Mississippi Department of Health Child Care Facility Complaint Form, a key tool for reporting concerns about licensed child care providers in Mississippi. This form is used to report concerns or complaints about the quality of care in licensed child care facilities, and you can access it online at the site noted above. It is managed by the Mississippi Department of Health, which investigates complaints thoroughly and promptly. Common complaints may include unsafe conditions, staff conduct, supervision concerns, and facility violations. Use this form to notify MSDH of regulatory violations in childcare settings. It's important to note, this form is a supplemental complaint tool. It does not replace legal or mandated reporting obligations. Always complete mandated reports first, especially in cases involving suspected abuse or neglect. Then use the MSDH complaint form to ensure regulatory oversight and follow-up in facility-based cases. This helps maintain accountability and improve care standards across licensed providers. Now let's walk through the steps of reporting abuse, neglect, or exploitation under the Mississippi Vulnerable Persons Act, which protects adults who are unable to care for themselves due to age, disability, or impairment. If you suspect abuse or neglect of a vulnerable adult, call the Mississippi Vulnerable Person Abuse Hotline. The line is available 24/7 statewide. If the situation is life-threatening, call 911 or your local law enforcement immediately. After making the oral report, you should also submit a written report using the online portal. Include as much detail as possible: name, age, and location of the vulnerable person, name and contact information of the alleged perpetrator and caregiver, a description of the abuse or neglect, and any actions taken, such as notifying law enforcement. This helps Adult Protective Services investigate thoroughly and provide appropriate support. Let's review key procedures for reporting under the Mississippi Vulnerable Persons Act, especially when law enforcement should be involved. If the suspected abuse involves serious bodily harm, sexual abuse, or criminal exploitation, then law enforcement should be contacted immediately. Additionally, Adult Protective Services will notify law enforcement within 48 hours if the case meets criminal thresholds for investigation or prosecution. This ensures timely coordination between protective services and legal authorities. Do not take photos unless you are authorized by your agency's policy. If photos are taken, typically by medical professionals, They must be handled according to strict confidentiality and evidence protocols, ensuring they are properly stored and shared only with authorized personnel. After making a report, document the incident in your agency's system. Be sure to include date and time of the report, method used to report, a summary of concerns, parties involved, and any follow-up actions taken. This documentation supports accountability and ensures continuity of care and investigation. Now let's take a moment to review how to report suspected abuse, neglect, or exploitation in licensed healthcare or residential facilities in Mississippi using the MSDH Healthcare Facility Complaint Form. This form is to report concerns observed in hospitals, nursing homes, residential treatment centers, and other licensed healthcare facilities. This includes suspected abuse of children, vulnerable adults, or long-term care residents. You can access the form online at the site noted on the screen. Use this form to notify MSDH of suspected abuse or neglect in regulated facilities. It serves as a supplemental report to regulatory authorities, not a replacement for legal or mandated reporting obligations. As a best practice tip, always complete mandated reports first, especially in cases involving abuse or neglect. Then use the MSDH complaint form to ensure regulatory oversight and follow-up in facility-based cases. This, again, helps maintain accountability and improve care standards across licensed providers. In addition to mandated reporting procedures, Mississippi provides several specialized contacts for reporting abuse, neglect, or exploitation, depending on the setting and population involved. For incidents in private homes, you can contact the Mississippi Department of Human Services at the number noted on the screen. Use this number to report suspected abuse or neglect of vulnerable adults living in private residences. MDHS, oversees adult protective services and investigates non-institutional cases. For incidents involving Medicaid providers or patient abuse in healthcare facilities, you can contact the Mississippi Division of Medicaid Office of Program Integrity at the number noted on the screen. Use this contact to report suspected abuse, neglect, or fraud involving Medicaid-funded services or patients in licensed healthcare facilities. This includes billing fraud, quality of care concerns, and regulatory violations. For complaints involving Medicaid providers or facility-based abuse, you can contact the Mississippi Attorney General's Office, the Medicaid Fraud Control Unit. You can submit an online complaint and you use the form to report abuse, neglect, or exploitation involving Medicaid providers or residents in healthcare facilities. MAFCU investigates criminal violations and coordinates with law enforcement when necessary. Coordinated mandated reporting across the crisis response continuum. Under Mississippi law, any person with reasonable cause to suspect child or elder abuse or neglect is legally required to report. This includes 988 call center staff, mobile crisis response team members, crisis stabilization unit staff, law enforcement, peer support specialists, and volunteers, if they observe or are informed of abuse. So how should coordination be handled? Well, first, think about clarifying roles early in the response, decide who will make the report and who will document, communicate across teams, use secure channels to share relevant information while maintaining confidentiality. Designate a lead reporter. Typically, this is the first responder with direct knowledge of the abuse or threat. And document thoroughly. Each team should record their actions, observations, and communications. A few best practices for team coordination. Use shared protocols or interagency agreements to guide reporting responsibilities. Ensure all team members are trained on mandated reporting laws and procedures. Follow up to confirm the report was submitted and received, and include reporting responsibilities in debriefs and supervision to reinforce accountability and learning. Now we're going to move on to duty to warn and protect. The duty to warn and protect stems from the landmark Tarasov case. It requires mental health professionals to take action when a client poses a credible threat to others. In Mississippi, this duty is permissive, meaning disclosure is allowed but not mandated. You may share information with law enforcement, the intended victim, or a guardian of a minor victim. Knowing when and how to act is essential in protecting lives while respecting boundaries. Let's take a moment to review the conditions under which licensed mental health professionals in Mississippi may disclose confidential information to protect others from harm. This guidance applies to psychologists, licensed social workers, marriage and family therapists, licensed professional counselors, and physicians. These professionals are permitted to disclose confidential information only under specific conditions. Disclosure is allowed when a client communicates an actual threat of physical violence, and the threat is directed toward a clearly identified or reasonably identifiable potential victim. This is known as permissive duty, meaning professionals are allowed to disclose this information, but they are not legally required to do so under Mississippi law. Some key considerations. Professionals should use clinical judgment and consult with supervisors or legal counsel when deciding whether to disclose. Any disclosure should be limited to what is necessary to protect the potential victim, and documentation of the threat and any actions taken should be thorough and timely. Let's review the appropriate parties to whom disclosure may be made when a client communicates a threat of physical violence under Mississippi's permissive duty to warn and protect. When a threat is made, licensed mental health professionals may disclose confidential information to the potential victim or victims, a law enforcement agency, the parent or guardian of a minor who is identified as a potential victim. This disclosure is intended to prevent harm and must be made in good faith. There are some important limitations. 1, disclosure must be limited to these specific parties. 2, it should include only the information necessary to protect the potential victim. And 3, professionals should document the threat and the disclosure thoroughly in accordance with agency policy. Now let's review when mental health professionals should engage law enforcement under Mississippi's permissive duty to warn and protect, and what role law enforcement plays in these situations. Law enforcement should be contacted when a client makes a credible and specific threat of physical violence toward an identifiable individual. The threat poses an imminent risk and cannot be mitigated through clinical intervention alone. The client is unwilling or unable to participate in safety planning or voluntary hospitalization. The professional determines that protective action is necessary to prevent harm. These decisions should be guided by clinical judgment, agency protocols, and the urgency of the situation. Law enforcement may be contacted to intervene immediately to prevent harm, conduct a welfare check on the potential victim, and assist with emergency transport for psychiatric evaluation or involuntary commitment. Some considerations around communication guidelines. Limit communication to only the necessary information required to protect the potential victim. Ensure all communication is made in good faith and is documented thoroughly, including the nature of the threat, the rationale for involving law enforcement, and any actions taken before or after the contact. When engaging the duty to warn and protect, accurate and objective documentation is essential. It supports clinical decision-making, ensures legal compliance, and protects both the client and the professional. Your documentation should include details of the threat, who made the threat, what was said or done, when it occurred, and how it was communicated, assessment of risk, your clinical evaluation of the seriousness and immediacy of the threat, rationale for disclosure, why you determined that disclosure was necessary under Mississippi's permissive duty to warn, the parties involved, including names and roles, consultations, a record, any discussions with supervisors, legal counsel, or agency leadership, date, time, and method of disclosure, specifically how and when the information was shared, and follow-up actions. Note any steps taken to ensure safety, such as safety planning, referrals, or coordination with other agencies. A few best practice tips: use objective and factual language, avoid speculation or emotional tone, Follow your agency's documentation policies and confidentiality guidelines, and ensure documentation is timely and complete, especially when law enforcement or other external parties are involved. In Mississippi, the duty to warn and protect is legally recognized as a permissive duty that applies only to licensed mental health professionals, such as psychologists, counselors, social workers, therapists, and physicians. If you are not licensed but are part of a crisis response team, your responsibilities are still critical, but they may be handled within the scope of your role and agency protocols. So, key responsibilities for non-licensed team members. Follow your team's crisis protocols. Always act in accordance with established procedures and guidelines. Engage or consult licensed professionals promptly. If you observe or are informed of a credible threat or safety concern, notify a licensed team member immediately. Notify law enforcement when appropriate. If your agency's policy allows and the situation warrants immediate intervention, contact law enforcement. Do not independently assume a duty to warn. Unless you are explicitly authorized by a supervisor, do not disclose confidential information or make decisions about warning potential victims. A best practice tip. Your role is to support the response process, ensure timely communication, and help facilitate protective actions, but always under the guidance of licensed professionals and agency leadership. Let's take a moment to apply what we've learned so far. So imagine this scenario. You're a crisis counselor at a community mental health center in Mississippi. A 17-year-old client arrives in emotional distress. They disclose that they've been physically abused at home and are afraid to return. During the conversation, they also mention having thoughts of harming a classmate who bullied them. The situation presents multiple legal and ethical challenges. Now, I'd like you to reflect on the following prompts. Under confidentiality, what information are you legally allowed or required to share? With whom can you share it? Under mandated reporting, are you required to report the suspected abuse? What steps must you take to comply with Mississippi's mandated reporting laws? Under duty to protect or warn, does the threat toward the classmate trigger a duty to warn or protect? Who should be notified and how? In a moment, pause the video and take 5 to 10 minutes to write down your responses. Think about how you would act in real time and what laws or policies would guide your decisions. Once you're ready, resume the training to hear expert guidance and compare your reflections. Let's break down the scenario using expert guidance in Mississippi law. So our scenario recap. A 17-year-old client reports physical abuse at home and expresses thoughts of harming a classmate. Under confidentiality, as a mental health professional, you are required to protect the client's privacy. However, Mississippi law permits disclosure when a client makes an actual threat of physical violence toward a clearly identifiable victim. In this case, the threat against the classmate may justify disclosure to protect others. You may share this information with law enforcement, the potential victim, the parent or guardian of a minor victim. Under mandated reporting, any person, including mental health professionals, who has a reasonable cause to suspect child abuse must report it immediately. This includes making an oral report, following up with a written report, and ensuring a referral is made to the youth court intake unit. Under duty to warn, protect, Mississippi follows a permissive duty to warn model. This means you are allowed, but not legally required, to disclose threats of harm to protect others. In this case, you may notify law enforcement, the potential victim, and the guardian of the minor victim. Another best practice tip, always document your actions thoroughly. Include what was disclosed, to whom, and why the disclosure was made. This ensures transparency and protects you legally and ethically. Now that you've reviewed the expert analysis, take a moment to compare it with your own reflections. What aligned? What surprised you? This kind of practice helps build confidence in navigating real-world crisis situations. Let's clarify the difference between legal and ethical responsibilities in crisis care. Legal responsibilities are mandated by law. For example, reporting child abuse is a legal obligation. Ethical responsibilities are guided by professional codes and values, such as respecting a client's autonomy. While there is often overlap between legal and ethical duties, conflicts can arise, especially in crisis situations. As professionals, we must navigate both to ensure responsible and compassionate care. Now we're going to move on to objective 2, ethical decision making under pressure. In this section, we'll explore how ethical principles guide your actions during mental health crises. These moments often require quick thinking, but also thoughtful reflection to ensure you're acting in the best interest of clients. Let's review some core ethical principles that shape our practice. Autonomy, respecting the client's right to make their own decisions. Beneficence, acting in the best interest of the client. Malfeasance, avoiding harm. And justice, promoting fairness and equity. These principles often work together, but in crisis situations, they can sometimes come into conflict. In Mississippi, crisis response teams are comprised of professionals and support staff from various disciplines. Each role may be governed by different ethical standards, or not at all. Understanding these distinctions is essential for maintaining integrity, safety, and accountability in crisis work. So let's look at ethical guidelines by role. Licensed mental health professionals, they have a code of ethics. The governing body is the Mississippi Department of Health and Professional Licensing Boards. Certified peer support specialists also have a code of ethics under the DMH-CPSS Code of Ethics. Unlicensed mental health staff, code of ethics kind of varies, may follow agency-specific policies, not governed by a state mandated code. Volunteers, they are not typically governed by a formal code unless trained under a certified program. And then law enforcement officers, they're governed by law enforcement standards, not mental health specific ethic codes. So what do you do when a role lacks a code of ethics? When a team member's role is not governed by a formal code of ethics, you want to clarify expectations through team training and supervision. Also establish shared protocols for confidentiality, safety, and communication. Encourage adherence to the ethical standards of the lead agency or clinical supervisor, and document clearly when ethical concerns arise and consult with leadership. Crisis response work often involves navigating complex ethical situations. So let's explore some of the most common dilemmas and how they may arise in the field. First, balancing client autonomy with safety. For instance, a client expresses suicidal thoughts but refuses hospitalization, or a youth in crisis wants to leave the facility against clinical advice. In these cases, responders must weigh the client's right to make decisions against the need to protect them from harm. This often requires consultation, documentation, and sometimes legal intervention. Navigating dual relationships in small communities. For example, you are called to respond to a crisis involving someone you know personally, or a former client becomes a colleague or community partner. Dual relationships can blur boundaries and complicate objectivity. Responders should disclose potential conflicts and seek supervision or reassignment when appropriate. Managing confidentiality under pressure. For example, a parent demands details about their adolescent's treatment, or a school administrator asks for updates on a student's mental health status. Confidentiality must be protected even under pressure. Responders should follow legal guidelines and agency policies and explain clearly what can and cannot be shared. Responding to cultural and value conflicts. For example, a family's values discourage open discussion of mental health, or perhaps language barriers create misunderstandings about risk or consent. Cultural sensitivity and clear communication are essential. Use interpreters when needed and approach families with respect while maintaining safety and ethical standards. When facing an ethical dilemma, a structured framework can help guide your response. So here's a simple 5-step model. 1, identify the ethical issue. 2, consider relevant laws and professional codes. 3, evaluate your options and your consequences. 4, consult with colleagues or supervisors. 5, document your decision and rationale. Using a framework really helps your decisions and ensure that they are defensible and aligned with best practices. When responding to a mental health crisis, decisions often need to be made quickly, but they have to also be thoughtful and informed. A decision tree can help guide your response by providing a clear step-by-step structure. So let's walk through this visual. At the top of the tree, the first question is there a threat to self or others? If yes, you move to assess the level of risk and consider actions like safety planning, hospitalization, or notifying law enforcement. If no, you continue with supportive interventions and monitoring. Next question is abuse or neglect suspected? If yes, you must follow mandated reporting laws, such as contacting the Department of Human Services and documenting the report. If no, proceed with standard care and note any relevant observations. You also need to consider if the client is refusing care. If yes, evaluate their capacity to make decisions and consider whether involuntary treatment laws apply. If no, continue with voluntary care and collaborative planning. Throughout the tree, you'll see reminders to apply relevant laws and ethical codes, consult with supervisors or legal counsel when needed, and document all decisions and rationale. This visual helps simplify complex decisions and ensure that your response is both legally sound and ethically grounded. Now let's apply this framework to a real-world scenario. You're working with a client in crisis who expresses suicidal thoughts but refuses hospitalization. They insist they're safe and want to go home. Pause and reflect on the following. What ethical principles are in conflict here? What steps would you take to resolve the dilemma? How would you document your decision? Pause the video and take a few minutes to write down your thoughts before continuing to the expert analysis. Let's apply the ethical decision-making framework to this real-world dilemma. So to recap, you're working with a client in crisis who expresses suicidal thoughts but refuses hospitalization. They insist they're safe and want to go home. First, identify the ethical issue. This situation presents a clear ethical conflict. Autonomy, the client's right to refuse care, versus beneficence, non-malfeasance, the professional's duty to ensure safety and prevent harm. Balancing these principles is at the heart of ethical crisis response. 2, consider relevant laws and codes of ethics. Review Mississippi Code 412161, which outlines criteria for involuntary commitment. And refer to professional codes of ethics, such as NASW or APA, that emphasize the duty to act when a client poses a risk to themselves or others. These sources help guide decisions that are both ethically and legally sound. 3, evaluate options and consequences. Option 1, respect autonomy and allow the client to leave. You may hold up rights, but risk escalation of suicidal ideation. Option 2, initiate involuntary hospitalization. Limits autonomy, but may prevent harm and ensure safety. Option 3, develop a safety plan with close follow-up. May balance autonomy and safety if the risk assessed as low. Each option carries ethical and practical implications that must be weighed carefully. 4, consult with colleagues or supervisors. Discuss the case with a clinical supervisor or team to assess risk and determine the most appropriate course of action. Consider legal counsel if the situation is complex or unclear. Collaboration strengthens ethical decision-making and ensures accountability. 5, document the decision and rationale. Record the client's statements, your risk assessment, and any consultations. Clearly note the rationale for the chosen action, including any disclosures made and follow-up plans. Thorough documentation protects both the client and you as the professional and supports continuity of care. We've talked a lot about the importance of documentation, and so I want to talk about some documentation best practices, which is one of the most important tools in crisis care. Accurate documentation is really essential. It serves multiple purposes. If it records the actions you took, your rationale, and any consultations you had, it should be objective, clear, and completed in a timely manner. Good documentation supports legal protection and ensures continuity of care. And always follow your agency's policies and any state-specific requirements. Here is a sample checklist to guide your documentation, including recording actions taken, including your rationale for decisions, noting any consultations, using objective language, documenting promptly, ideally within the same shift or 24 hours, follow agency format, include legal, ethical considerations, and avoid vague terms. This checklist helps ensure your notes are clear, defensible, and align with best practices. Remember, if it's not documented, it didn't happen. Now we're going to move on to section 3, professional boundaries and cultural considerations. In this section, we'll explore how to maintain ethical clarity and cultural responsiveness when working in crisis care. These elements are essential for building trust and delivering respectful, effective support. Maintaining professional boundaries is essential in crisis response. Boundaries protect both the responder and the client, ensuring ethical, safe, and effective care. Crisis responders must define the scope of their role early in the interaction. This includes clarifying the purpose of the intervention, avoiding over-involvement or promises beyond your role, respecting time limits and agency protocols. Boundaries help to maintain trust and prevent dependency. In small communities or close-knit systems, dual relationships can arise, such as responding to someone you know personally. To manage this, disclose potential conflicts to supervisors, request reassignment when possible, and maintain professional conduct and avoid blending personal and professional roles. Crisis situations can be emotionally intense. Responders need to stay grounded and focused on the client's needs, avoid reacting emotionally or making decisions based on personal bias, and use supervision and peer support to process difficult cases. Crisis work also often involves collaboration across law enforcement, healthcare, schools, and social services. To maintain boundaries, respect each agency's role and scope, share information appropriately and securely, and follow interagency protocols for communication and confidentiality. Crisis work requires strong boundaries to protect both clients and professionals. So let's explore some common boundary challenges that can arise in the field. Dual relationships. For instance, providing crisis support to someone you know personally. This can blur professional boundaries. Being asked to serve in multiple roles, such as therapist and case manager, which can create confusion and ethical risk. So a best practice here is disclose potential conflicts and seek supervision or reassignment when possible. Over-involvement, such as offering transportation or financial help, may feel compassionate but can compromise objectivity. Or spending time with clients outside of professional settings, which can lead to dependency or role confusion. So best practice here is to maintain clear limits and refer clients to appropriate resources. Self-disclosure, sharing personal stories without clinical relevance can shift the focus away from the client, or expressing personal opinions may unintentionally influence client decisions. Best practice is use self-disclosure sparingly and only when it serves a therapeutic purpose. After-hours contacts. Responding to texts or calls outside of work hours can erode boundaries and lead to burnout. And engaging with clients on social media can compromise privacy and professionalism. Best practice tip here is to set clear expectations around availability and communication channels. Gift giving and receiving. Accepting gifts may be culturally appropriate, but can raise ethical concerns. Feeling obligated to reciprocate can shift the power dynamic. So, a best practice is to follow agency policies and consult supervisors when unsure. Cross-system partnership issues. Collaborating with law enforcement, schools, or child welfare agencies without clear role boundaries can lead to confusion. Pressure to share confidential information outside of legal or ethical guidelines must be resisted. Confusion over who leads decision-making and joint responses can delay action. Best practice here is to clarify roles early, follow interagency protocols, and protect client confidentiality. Cultural responsiveness is essential in crisis care. It ensures that interventions are respectful, relevant, and effective across diverse communities. So let's take a look at different elements of cultural responsiveness in crisis care. Respecting difference. Every individual brings unique cultural values, beliefs, and experiences. So we want to approach each person with openness and respect and avoid imposing our own worldview or expectations. Avoiding assumptions. We don't want to assume someone's needs, beliefs, or behaviors based on their background. We want to ask questions, listen actively, and allow the person to define their own experience. Practicing cultural humility, recognizing that we're not the expert on someone else's culture, and be willing to learn and acknowledge the limits of our own understanding, as well as explore another person's perspective with curiosity and compassion. Adapting interventions. Effective crisis care must be flexible and culturally attuned. So we want to adjust our approaches to align with the person's values, communication style, and behavior norms. We want to use interpreters when needed and be mindful of cultural nuances in verbal and nonverbal communication. And we want to tailor safety planning and support strategies to fit the cultural context. Crisis responders often face complex situations where professional boundaries and cultural sensitivity intersect. So let's explore some common challenges and strategies for navigating them effectively. So a challenge, responding to clients from different cultural backgrounds under time pressure. We may have limited time, which can lead to assumptions or misinterpretation of cultural norms. So some strategies here are to use cultural sensitivity screening tools when available, ask open-ended questions to understand the client's values and beliefs, and avoid rushing decisions. Pause when possible to reflect or consult with colleagues. Another challenge is navigating blurred boundaries in small or rural communities. Dual relationships and overlapping roles are more likely in close-knit settings. So some strategies here are set clear expectations with clients about your role, document any potential conflicts of interest, and consult with supervisors when boundaries feel unclear or compromised. Another challenge is balancing empathy with professional detachment. Emotional involvement may cloud judgment or lead to overstepping boundaries. So some strategies here are to engage in reflective supervision or peer consultation to process emotional responses, use grounding techniques to stay present and objective, and maintain a focus on the client's goals, not your emotional reaction. So now let's take a moment to reflect on your comfort level with the following situations. Accepting a small gift from a client, responding to a crisis call after hours, and sharing personal experiences to build rapport. Pause the video and consider the following. How do your own cultural values influence your responses to these scenarios? Write down your thoughts before continuing with the expert analysis. Let's review some expert guidance. Accepting gifts may be culturally appropriate, but it can blur professional lines. So always consider context and agency policies. After hours contact should follow agency guidelines and be documented. Self-disclosure can help build rapport, but it should be intentional and clinically justified. Cultural awareness helps you navigate these decisions ethically and respectfully. Maintaining boundaries doesn't mean being distant, it means being intentional and informed. After completing crisis response training, it's important to follow up with your employer to clarify expectations, resources, and protocols. And here are some key considerations to guide that conversation. Asking, about legal responsibilities, such as what's your agency protocol for mandated reporting? What are the procedures for handling threats to self or others? How do you ensure compliance with HIPAA and state-specific confidentiality laws? Ethical decision making. Is there a formal ethical decision making framework we're expected to follow? Who should I consult when facing an ethical dilemma in a crisis situation? As well as, are there guidelines for balancing client autonomy with safety? Potential follow-up questions around professional boundaries. What are the expectations around dual relationships in your community? How should I handle after hours contact with clients? And are there policies on gift giving or self-disclosure? Questions around cultural responsiveness. Does your agency offer training or resources on cultural humility? How do we adapt crisis response to meet the needs of diverse populations? And are interpreters or culturally specific supports available? Questions around documentation. What format and system should I use for documenting crisis interventions? What details must be included to meet legal and ethical standards? And how soon after a crisis event should documentation be completed? And then some questions around team roles and ethics. Which roles on our crisis team are governed by a code of ethics? What guidance is available for working with the non-licensed team members? And how do we ensure accountability across disciplines? Again, some post-training questions that might be helpful to you in asking your employer to get further information. And now, here are some key references that inform this training. These include federal and state laws, professional code of ethics, and evidence-based practices in crisis care. We encourage you to review these resources for deeper understanding and also to stay current with legal and ethical standards in the field. I also want to share with you a number of additional training topics. There's an entire library of training topics on a number of different modules. These resources are really designed to support your growth and confidence in crisis response. So we hope you will take advantage of them. And also be sure to stay connected with DMH. Follow DMH on social media for updates, including upcoming training opportunities, and just join the conversation. Be a part of a community that is committed to ethical, compassionate crisis care. Thank you for participating in this training. Your commitment to ethical and culturally responsive crisis care makes a really meaningful difference in the lives that you serve, and we hope this training equipped you with practical tools and insights to support your work. Thank you again.